Hello there, welcome to yet another very interesting edition of Health Matters, a program where we x-ray issues concerning your health and try to make you stay fit and healthy. And it's reaching you on NTA Channel 12 Radio. My name is Omo Basi Edit, your host, and tonight we have in the studio the chairman Ibom Life Saving Advocacy Group, Dr. Mando Ekpeyong. Hello and welcome to the program.
Thank you. Thank you. Good evening, everybody.
And on Health Matters today, we'll be looking at contraceptives. What do you know about contraceptives? Some few weeks ago, we had a field trip to some communities in Akwa Ibom State, and we discovered a lot of teenagers are going down with pregnancy. And it's been a thing of concern. And so when we are talking about contraceptives, Dr. Mando, what are contraceptives?
I think we should start by bring up to light what is contraception. Contraception is, in a common word, we can say family planning. Okay. Is using some methods to space a pregnancy. That is saying that is a way of controlling getting pregnant and planning for the number of children that you want to have and you can cater for, which means you only have children, that's give birth to children when you need them, not when the children needs you. Is about making a choice on your, that is, we can say making reproductive choices.
Okay, when you say giving birth to children when you need them, some people just believe that children are gifts from God, so they just keep on having these children. Is it right to have children that you don't plan for?
Actually, it's not right. And, for people to believe that you can have children as you want is a belief and is a misconception. That's why we are advocating about importance of planning to have the number of children that you can actually cater for, because you know that just as you rightly said in your introduction that it has been observed that many of our young girls are getting pregnant, and some of them, I want to tell you that they have gone into abortion, and there is a recorded high rate of death due to abortion. Mostly criminal abortion. And even to the women that are married, if they keep giving birth, getting pregnant as many times as they want, there's tendency to have complications, and that will also increase the maternal mortality, that is maternal death due to pregnancies and birth.
Okay, and then apart from the health risk, I'm sure there are so many other issues bringing children that you didn't plan for. Maybe the children, you see children on the streets, they call them street children. Don't you think it also has some kind of societal effects?
It does, because when you don't plan for pregnancy and maybe plan for the children that you are expecting, there's a high incidence of poverty. There's high incidence of poverty. So when you cannot cater for these children, sometimes in our cultural beliefs, they will tag those children as being witches, and they drive them away from home, maybe because of religious belief and biases. So if you had gotten the number that you can cater for, nobody will come and tell you that your child is a witch and you believe. So some people give allowance for those things to be said, so they have cause to leave their children to stray. I want to tell you that not even those ones that are being tagged as being witches or wizards or whatever, even some, because you cannot take care of them, there's nothing you can do. You leave them to roam, and they contribute nuisance to the society. When you are talking about cultism, the rate of children that are involved, even right from primary school, in cultism, not because they enjoy it, but because they are looking for a way of survival. So they take solace in going about with their pets to look for a way to survive. So it's really bad.
Exactly, and you see that at the end of the day, some of these street urchins become the criminals. They come robbing people, snatching bags, pickpockets, and all of that. So let's still talking about this family planning. What are the types of family planning available to women and young girls who are already sexually active?
We have barrier methods, we have hormonal methods, we have a permanent method. Talking about barrier methods, it could be the use of condom, and talking about hormonal methods, it could be the use of pills, it could be the use of injectable, it could even be implants. Then we have the IUDs, which is the insertion method. And for permanent method, which applies to both male and female, it could be tubal ligation, it could be vasectomy. There are various methods that when you access the facilities, the health facilities, and you go to the family planning unit, you really take time to tell you all about the methods, the effects, and how it works.
Okay, and then that takes us to accessibility and affordability. How accessible are these contraceptives?
I would love to say that it's accessible, and talking about affordability, not in entirety, because of the socioeconomic status of the people, that is not actually the same. It's not everybody that can afford, notwithstanding the cost of each service. So that's why, as an advocate, that my group is advocating for making the commodities for family planning services available, because sometimes you see a client walk into the clinic and she'll be told that the choice that he or she has chosen or has made is out of stock. And sometimes when we advocate that family planning is free, by the time a client gets to the health facility, the health staff will say, no, it can't be free because consumables are not available. Oh, we're talking about consumables. We mean things that are used in carrying out these services. It could be like the gloves, it could be like the disinfectants and the likes. So when it's not there for the health worker to use, they will ask the clients to pay something for it, but it's not every client that can afford it. So I could say it's accessible because we have really sensitized people, advocates that people should take up family planning, and the number of people going for family planning is actually up. It has increased from the level that it was. But the unfortunate thing is that when they get to the facility, sometimes the commodity is not adequate or is not available, and the consumables are not there. But let me say this, there's something that is called basket fund at the national level, the federal level, in which every state is expected to contribute to that basket so that commodities could be made available to all states. But it's unfortunate that up till now, but I believe my governor will do it. Up till now, Akwa Ibom has not keyed in. He has not contributed a mite to that basket fund. When during the sharing formula, it's those people that have contributed that will have the more quantity of commodities compared to the one that will come to Akwa Ibom. So that's why we keep advocating that the governor should do something about it. Thank you.
Okay, now talking about these contraceptives, we are looking at family planning and also considering contraceptives beyond preventing unwanted pregnancy. Hello there, welcome to yet another very interesting edition of Health Matters, a program where we x-ray issues concerning your health and try to make you stay fit and healthy. And it's reaching you on NTA Channel 12 Radio. My name is Omo Basi Edet, your host, and tonight we have in the studio the chairman Ibom Life Saving Advocacy Group, Dr. Mandu Ekpeyong. Hello and welcome to the program.
Thank you. Thank you. Good evening, everybody.
And on Health Matters today, we'll be looking at contraceptives.
Attend to other things, to look for money, to cater for the children. The woman will be sick and she will not even be able to afford health services if she doesn't have stipend. Or the husband that is taking care of that family might not have money to cater for the family. So you see, to individual is important so that you can live healthy and you can have power to take care of that your child or the children. We are not talking about maybe if you can afford or you can cater for 10 children, you should not have the number that you can cater for. Then benefits to the family is that it will instill love among husband and wife, because by the time you keep delivering and your husband is the only person that cater for the family, he will be tired. And most so you will not be looking, we were talking about the health of the woman, you will not be looking good for your husband to appreciate you, and from there maybe he will look out to other beautiful women or young girls, and from there will be problem in the family. And again, to the nation, you know, when you have a productive people that are productive, the GDP will be high. You know, there will be not that there will be no poverty, but the rate of poverty will be reduced to an insignificant level. And more so, the rate of maternal mortality will be reduced, will be drastically reduced. If not, you see women dying in pregnancy, dying during birth, and so forth. What of the young girls? When they are pregnant, maybe because of shame, they want to go and do abortion. And maybe they cannot afford therapeutic abortion, they go for criminal abortion. And maybe the quack way that they are going through it, they will die. There are so many incidences of death due to abortion. So it's important, it's very important that, you know, like on the 26th of September every year, is set aside to celebrate. It is called World Contraception Day. So the 26th of this September, it will be celebrated, World Contraception Day, and the theme is choice for all. What else? That you freedom to plan, and also you have power to choose.
Yeah,
that covers all that I have said.
Yeah, exactly. And you know that you said something about women taking care of themselves, and just this morning I read a story presented by a woman who just put to birth through CS, and then she's now saying she doesn't know, she's barely 6 weeks gone after delivery, and then she doesn't want her husband to start going outside to look for side chicks, and she was not seeking people's opinion that, oh, can she start making love with her husband and all of that. And people were wondering, 6 weeks postpartum and through CS, what is it that women really want in this life? So you are doing all that so that your husband will not go outside and look for a side chick, and then you are putting yourself at risk. So I mean, is it really advisable to do those kind of things?
It's not advisable. That is why we are advocating for family planning. She needs to go to the clinic to be advised, to be counseled. Yes.
Okay, and so you are just joining us. The program is Health Matters, and we are talking about something very interesting, that's family planning, contraception. I mean, the choice is yours. You can't bring children to this world just because God said go to the world and multiply. Then you just keep bringing children that you cannot cater for, and you also put yourself in harm's way. So Dr. Mandu Ekpeyong is the chairman, Ibom Life Saving Advocacy Group, and she's been doing justice to this topic. Don't go away. So Dr. Mandu, moving on now, the age for contraception. Who can go for contraceptives? At what age can people begin to access contraceptives?
Before, we could say from 18 years. But from studies we have actually, and from what we have seen, that a 15-year-old can actually get pregnant. So we can tame contraception age from age 15 and above. So if you are a female and from age 15, you should know that you can get pregnant. And if you are a boy child, and you are age 15, you should know that you can get somebody pregnant.
And so, because it's like we've been talking about women and girls, so boys actually also they should. And what are those choices available for the boys?
The boys is the barrier method, the use of condom.
Okay.
Yeah.
Okay. And I think women also have, we also have
Yes, we
female
have
condoms.
female condoms. It's available in the health facilities.
Okay. So now let's look at the side effects of contraceptives. What are those short-term and long-term effects?
Well, from records, the side effects are really minimal.
Okay.
And it could only be loud if you don't heed to the advice of the health staff or the provider. By that I mean, because they are not things that are naturally in us. It's just like we take other drugs, even some food that we take. Sometimes some people react to it. So when you access a facility and make a choice, you'll be cancelled. And on those things that you may see, that you may have this symptom, you may have that sign. If you have it, come back to the facility immediately and report. And when you get to the facility staff, the provider will be able to tell you, oh, it's just a short-term, it will go off, reaction, or if it continues, come back to the clinic. Maybe they will also look at other conditions, because some of these reaction is a coincidence. You may really have one disease condition or the other. Then by the time you come to take off family planning, it manifests. And some people will feel that it's because of family planning. I'm here to tell us that the side effect of family planning is really mild. It's not something that, except you have other conditions, and it's left for the facility staff or the provider to be able to tell you and to prove to you that it's not the family planning. That will be done through other tests that will be done to really know whether the cause is from the family planning. But most of the times, it's not from the method being chosen.
We also have instances of young girls who have been using pills over a long period, coming down with infertility. Could it be connected in any way because of your persistent use of pills to stay away from unwanted pregnancy? By the time you now start looking for these babies, some people say they don't come, the babies don't come at the end of the day. Is it true?
Well, when we are talking about pills, taking of pills, it contains some hormones like estrogen or progesterone. So when you take it, it has its own function in your system, maybe to alter the what should I say, the level of those hormones. Maybe the one that would have been high to really cause pregnancy will be low, and things like that. So they are usually advised because when you take on a particular method like the pills, it will take time for your system to get used to that pills, and it also takes some time for the effect of the pills to be withdrawn. So they are usually advised that if you know that you intend to be pregnant, maybe in the next 5 or 6 years, maybe 6 months to that time, you discontinue. Because the problem we have in this part of the world is that we don't stick to instruction or advice. We just do it. The other person said she did it, so if I do it, and you know that the composition or people's system is not the same. Yes. True. So it is usually good to give your system some time for the withdrawal effects to take place. But there are people that don't wait, immediately they discontinue, they'll get pregnant. And then most, I want to say this, if the client expected to be pregnant immediately, she stops taking the pills and she doesn't get pregnant, she can start being worried. And when you are worried, your system will change. Exactly. So it might not be the cause of the pills. It could be her mindset, and maybe she's been thinking and got the stop until maybe the adrenaline level will rise up and will begin to kink her tubes. And it might not. I want to tell us that most at times is not because of the pills. Yes.
Wow, thank you so very much, Doctor. And still talking about the effect of contraceptives, can you link them to, because some people are actually afraid. Some women, you speak with them about using contraceptives and they'll now say, oh, it causes cancer. Is it linked to cancer in any way?
I would like to say that I told you I have just exposed the theme of this year contraception. They say choice for all, and I want to say that creating access to family planning, we also have a duty. I have a duty, you have a duty to fight against barriers to family planning. Poverty is one of them, but I want to speak on misconception. That could be a misconception. You know, I earlier said that sometimes you have other causes of disease that had been there, but coincidentally it manifests after taking contraceptives. So as a human being, you feel that, oh, I didn't have this, it's because of this. And you know, we don't have the attitude of going to the hospital except we are sick. But it is advisable that from time to time, you don't need to be sick. You need to access a health facility to check your system. So if we have this attitude, then we would have been able to determine if the cause of this cancer had been there or if it's caused by contraceptive. If it is true, it's going to be very minimal. I don't have data to speak on that, that contraceptive can actually cause cancer.
Okay, and so on the whole, you want to say that, are you advising people to patronize these contraceptives? Are you encouraging the use of contraceptives by our men and our women?
Yes.
What's your take on that?
Is a choice for all. Yes, that's what I'm advocating for, that there is need to take up family planning, and most so the government should support the uptake of family planning through making it absolutely free and through the provision of commodities and contraceptives, especially contributing to the basket fund.
Thank you so very much, Dr. Mando Ekpeyong, the chairman, Ibom Life Saving Advocacy Group, and the program was Health Matters. Today we are discussing family planning, the use of contraceptives, and you've heard it all. There is need for you to make informed choices. Don't expose yourself to any risk. It is not worth it. And that's it. I remain Umoba Sedate. Thanks for watching. Let's make it same time next week. Bye-bye.